today's training module on the introduction to IPUMS NHIS. In this module, we would provide the overview of the IPUMS NHIS and its purpose, explain the NHIS data itself and its importance, and I will guide you through how to access data on the IPUMS NHIS. So what is the IPUMS NHIS? IPUMS stands for Integrated Public Use Microdata Series, and the NHIS part stands for the National Health Interview Survey. The IPUMS NHIS is a project of the University of Minnesota that provides harmonized data of the National Interview Survey that has been conducted annually over the years. And the NHIS actually is run by the National Center for Health Statistics since 1957. IPUMS NHIS is designed to make the NHIS data more accessible and easier to use for research purposes. The IPUMS NHIS also is structured as a microdata, which is embedded in its name. And what does that mean? It means that each observation in the dataset represents an individual respondent to the survey. The data is also anonymized. That means that personally identifiable information is not included in the dataset. Now, the IPUMS NHIS is a valuable tool for researchers, especially those who are interested in public health outcomes in the United States. The data is accessible and easy to use, and it provides a wealth of information, as you will see shortly. With this introduction, let's take a deeper dive into what the NHIS data itself is. Now, the NHIS, National Health Interview Survey, is an annual survey. It is conducted by the National Center for Health Statistics, which is part of the Centers for Disease Control and Prevention. The survey collects information on wide range health-related topics, and the population represents the entire US, excluding those who are institutionalized and those who serve in the military. The NHIS is conducted, the data is conducted through an interview platform, a face-to-face interview with respondents, and the survey itself comprised of two sets of data, a core set of data and an additional questions which changes every year. The core data does not change. The easiest way to access the National Interview Survey is by just typing National Interview Survey in Google, and on your first search brings out the National Interview Survey, which you can click and it will bring you to the homepage of the National Interview Survey. Now, the NHIS data is important for research and policy for several reasons, and this might inform researchers on what they can use NHIS for. I'll talk a little bit about this. First, it provides a comprehensive picture of the health status and healthcare utilization in the US. It also gives information on the trends of health outcomes across the years, and it can also help in identifying disparity in health outcome by demographic characteristics. So it's a hugely powerful tool to study health disparity or health outcome research. Secondly, the NHIS is used to monitor progress towards a particular goal, especially the Healthy People 2030. That's a goal which has a couple of metrics. You can actually use the NHIS to monitor progress towards these metrics. Lastly, the NHIS is used by policymakers and healthcare professionals to inform decision and policy regarding health of the US population. For example, the NHIS data can be used to assess the impact of a policy that has been started at a particular point in time, and now it reflects on the population over time. And a case in point here is the Affordable Care Act. So you might want to find out, since this has happened, this policy has been enacted, what has been healthcare insurance pattern like across a specified number of years. Now let's talk more on the IPUMS NHIS, which is the major reason why we are here, but we know what the NHIS itself can do, the data itself can do. So going back to IPUMS NHIS, how best do we access this data? The best way is Google. You can type IPUMS NHIS here, and as I'm doing, and click on enter, it will take you to IPUMS NHIS web link, and when you click on it, it takes you to the home page. Now I have signed in into the IPUMS NHIS platform, but I will log out now just to show you how best to access this data. So if this is the first time you are using the IPUMS NHIS, first you will have to create an account. The first step to obtaining this data is creating an account, and to create the account you will click on apply for access. When you click on apply for access, it will take you to this form, and you will write your email, type in the password, confirm your password again, write your first name, your last name, the name of your institution or employer is required, and the institutional or personal website, that is not required, but if you have it, it will be good to add it. The next thing is you fill all the other categories: occupation, field of research, research areas, general research statements. You can write up all of this. Some are required, some are not. And when you finish filling the form, you have to accept the license agreement, redistribution, usage, confidentiality, and citing the IPUMS NHIS appropriately for your research. You have to accept all these conditions, and then click on submit. After you click on submitting the form, you might have to wait for a couple of minutes to hours, in some few cases maybe a day or two, but it's not very common. Usually in minutes to hours you have your approval, and once you have your approval, then you can log in. I am going to log back in to show you what the platform is like. So I'll go back into the login page because I already have an account, and I'll click on login. Now when you click on login, it will take you to your email address, password, which you enter. Click on sign in, and after you've done that, it takes you to your home page. I'll go directly to the home page now, and on the home page, two major things you will see: the National Interview Series and the Medical Expenditure Panel Survey. For this tutorial, we are focused on the National Interview Series, so we click on Get Data here. And once we click on the Get Data, where does it take us to? This very busy page. And but for ease of navigation, just consider two major sections of this page: the top right hand corner and the left hand corner. Let's start with the left. The left talks about everything about the IPUMS NHIS, about it, register, donate to IPUMS, then the data, what the structure of the data is, documentation, support, research, all of those information, some of which I've talked about earlier. You can find it on the left hand of the page. Now let's focus on how you get the data. The data itself is housed in this select data icon. So once you click on select data, it brings you to a page where you have three major groups of variables: household, person, injury. Now the A to Z is an alphabetical listing of all the variables, which is also useful, especially if you know with the variable you're looking for. And then there's a search icon here, in which you can, if you know the variable name or the variable ID, you can literally search for the variable of interest. Now we'll talk a little bit more about select sample, but let's focus a little bit on the select variables. Select variables just refer to the variables of interest: demographic characteristics like age, race, education. Now select samples refer to the years. I want 2020 to 2022, or I want 2010 to 2018. You can select your samples you can select the years by clicking on the select sample icon. But let's start with the three major icons here. When you click on the three major icons, it gives you a drop down: technical, household, geography, housing characteristics. Now under person, you have very many more variables: technical person, demographic, socioeconomic status, and a whole lot more. Some of these variables are actually of particular interest to me for the research I do, and some are just very consistent with any research that you might want to do. For example, demographic characteristics. If we click on the core demographic, you will see some basic information that you would need for any research, like age, sex, sexual orientation, legal marital status, current marital status. And you can see here that on the right hand of the page, we have some numbers here: 21, 20, 19, 80, 17, 16, and it goes way down. And if your guess is as good as mine, you realize that we're actually referring to the years of variables that we have. So for example, age, you can have from 1997 to 2021. Actually, you have more than that. If we scroll to the rightmost end of the page, you can see that we have age starting from 1963 up to 2021. But that's not the same for sexual orientation. We have the variable starting from 2013 up to 2021. Now, because the variable is here, doesn't mean that there is no missingness in the variable. And we'll talk about missingness in the IPUMS NHIS or the NHIS itself in the later videos. But what does the X and what does the dot mean here? The X means that we have data, and then the dot means that we do not have data for this year. So you can see here that legal marital status of cohabiting person, we have ... for 2019 to 2021, but between 1997 to 2019, we have data on it. Now, ever been married, we have data on it from 2019 to 2021. That suggests that there's probably change in the ordering of these questions in the National Interview Survey. They stopped asking some questions and they started asking other questions. Now, we'll talk more about picking specific variables in later videos. We'll actually design a research question and I'll walk you through the step of extracting this video. But let's take another look at the injury tab. Injury tab, it's a little bit different. The structure is a little bit different, but then the principles are exactly the same. So all the information that you need, as I said earlier, will be here. Once you know the variable you are interested in, just go ahead and click it. But if you want to search for variables of interest, you can click on search. For example, I'm interested in falls, and I can click on falls, and then click on my search button here, and that can give you information about falls. For example, number of falls cutting grass greater than half a day in the past 12 months. We can all see all of this information here. You can see that we have ... That means that for some years we do not have this information, but for some years we have this information. For example, the variable I talked about, the last time it was asked was 1991. Okay, now we have a grand view of the structure of these variables, but then let's talk about the select sample. Now, the select sample, when you click on it, you'll be taken to a page where you can select the years. Now, we can start from 1997 upward, and when you click on it, everything gets clicked. So, but here, let's look for more recent data. More recent data starts at 2021. So, as at the time of this recording, which is 2023. So, if I need information, 10-year data, or maybe let's start from 2010. I just click on 2010 and then 2020. So I have 12 years of data, and I can extract all those years, the information, the data for all of those years. More importantly, if there's anything you must not forget about the IPUMS NHIS, it is a survey. So whenever you are extracting information, always have in mind that it is a survey, and the best approach to addressing analysis using survey data is applying your survey weights. The good part is that for IPUMS NHIS, it's automatically added to your data extract. And that will take me to the last thing I'll talk about, which is your data extract. And for me, it is under my data. So when you start creating your data, it will be pulled into this particular web page where you have my data. You can see all of my data that I've been using, that I have since I started using the IPUMS NHIS. Now, let's go back. And essentially, we've talked about a couple of things in this video. One, we talked about the IPUMS NHIS. We talked about the NHIS itself, and I walk you through the main icons, the main tabs of the IPUMS NHIS. In the next video, we'll talk about how to extract information, the data itself from the IPUMS NHIS, and import it into the statistical tool of choice. Thank you very much. Thank you for your time. Bye.